Welcome to Blessing Center for Technical Arts and Sciences. This is our Nurse Aide Training Program virtual open house. Let's start out with our agenda for this open house, and that's really to give you an overview of the program, talk about our clinical site, the admission process, student success, and career services. So let's start by meeting our educators. We have Dr. Galani, and Dr. Galani is our administrator here at Blessing Center for Technical Arts and Sciences. My name is Amanda Butler. I am your program coordinator as well as your primary instructor for the Nurse Aide Training Program. Here at Blessings, we have a mission statement for our Nurse Aide Training Program, and that's to provide a positive and supportive environment conducive to learning the fundamentals of patient care. We strive to prepare each individual student with the knowledge and skills necessary to pass their state competency exam. We encourage students to make advancements in their careers and education using this program as a foundation for success, and we believe our success comes from our students' ability to provide compassionate, quality patient care. Our course objectives are really to introduce students to the nursing assistant profession and to prepare them for that PA state competency exam. We're going to do this in the classroom, in the laboratory, and then in a long-term care facility. Class goes by very fast, and it only takes place over a 5 to 6 week period, with our last week being in that long-term care facility. We're going to have lessons in all sorts of activities of daily living. We're going to touch on dealing with difficult behaviors. We're going to talk a lot about abuse, neglect per Act 14. We're going to talk about behavioral health, how we recognize depression and anxiety. And we're also going to spend some time on infection control. Like I said, we're going to have a 1 week of clinical experience, and this is going to take place at Deer Meadows Retirement Community on the Roosevelt Boulevard in Philadelphia. They have several different units, and we're going to be on the long-term care unit. At the end of the 5 to 6 week course, after you've completed all of your quizzes and the final exam, you will receive a certificate of completion. This states that you have passed the Nurse Aide Training Program and you are ready to sit for your PA state competency exam. Now, the PA state competency exam really consists of 2 parts, and those are written and skills. So the written portion of the test, you're really going to learn a lot of that from your classroom time and your laboratory time. All of the quizzes that I'm going to give you during class time are really meant to prep you for the state competency exam. The skills portion is really going to be to perform 5 skills in front of a state examiner. Now, automatically, they're always going to ask you to perform the skill of hand washing. So that's one automatic that you know you will be asked. And the other 4 could be anything that you've learned in lab as far as skills goes. And that could be maybe obtaining a blood pressure, obtaining a pulse, measuring urinary output, transferring a patient. So you should really become very competent in those skills. After you receive a passing grade on the state competency exam, you are then put on the Pennsylvania State Registry. So where do I start? How do I get in? Let's talk about the admission process. So the admission process, we have an application that is online. I will give you the information of how to access that here in just a moment. What are you going to need in order to get into the program? So here is a copy of our admission checklist. You'll see that we need 2 forms of ID. So this could be your passport, driver's license, ID card, social security card, birth certificate. One of those forms of IDs must be a photo ID, but the other one could be a birth certificate or social security card. We're also going to ask for your education documentation. So it is a requirement for this course that you have either a GED or high school diploma. So that's really what I'm looking for here as far as your education documentation. If you lived in Pennsylvania for the past 2 years, I'm going to ask for a Pennsylvania residency verification. If you lived outside of PA in the last 2 years, I'm still going to ask for the Pennsylvania residency verification, but I'm going to also have to run an FBI report. Everyone who enters into the program will also have to have a PA criminal history record. And then we are also going to require a physical exam. The physical exam does require a tuberculosis screening, so whether you have a PPD or quantiferum gold. And then it also states that you're free and clear of all communicable diseases. We will also be sending you for a drug screen, and we're going to talk about that a little bit more here in a moment, but that will be at Quest Diagnostic Centers. You'll have a pre-admission test that you will take, and that's going to be through Wonderlic, and we'll talk about that here on the next slide. And then the last item that you will need for the submission checklist is a signed acknowledgement stating that you've never been excluded from Medicare, Medicaid, or any other federal health program. So Wonderlic test prep. The Wonderlic is our admission exam. It assesses your quantitative and verbal skills, so your math skills and your communication skills. We're looking for a minimal score of a quantitative of 241 and a verbal score of 230. These scores are based on an 8th grade level, just to kind of give you an idea. The Wonderlic test will be taken at orientation, and you will know your test results immediately after taking the test. Quest Diagnostics, like I said, we're going to require a 10-panel drug screen. So every student who meets the minimum requirements for admission will be set up electronically to have a drug screen. And these will take place at a Quest Diagnostic Center of your choice. And then Quest Diagnostics will send us back the results electronically. So how do you secure your spot? Like I said, you should apply online today. You can do this on our website. You can do it by emailing me directly and asking for the link, or you can do so by calling the number I have provided here. Our entrance into the course will be based off the admission criteria on a first come, first served basis. So once you get in everything that I need from you, I will then move forward with your application and getting you scheduled for that first day of class. Student success. So it's our expectation that all students admitted into this program will successfully complete the program. And upon admission, students will fill out a success questionnaire. This really helps me, the primary instructor, target your areas of strengths and weaknesses so that we can overcome any of your weaknesses you might have. We'll also do this throughout the course, once again, just to make sure that I support your learning needs so that you really go ahead and pass that state competency exam. It's our expectation that all students are 100% dedicated at the time of their admission, and if they feel that they are not 100% dedicated, then we ask them to withdraw and to sign up for a later course. At the end of the course, we will have a mock test day. So that mock test day is really to reflect that state competency exam. It's going to have your final exam, which is going to be 70 questions, and then we're going to test you on 5 skills. I will grade your 70 questions. I will not grade your 5 skills, but I will provide feedback. And if you do not pass your 5 skills, we will remediate, and you will do it until you pass your 5 skills. Once again, prepping you for that state competency exam. After you successfully completed your final exam, so that final exam with me during the mock test day, we'll schedule a one-on-one and we'll meet. We'll talk about any questions that you might have before you go to take your state competency exam, and then I'll help you with registering and scheduling that state competency exam. It's our expectation that you pass that state competency exam the very first time. However, you may take it up to 3 times. It just might come with a financial cost. I want to also let you know we're going to be offering career services throughout this whole course. Like I said in the beginning, this is really to build the foundation for your healthcare career. So we want to help you with resume building. We want to teach you how to use Indeed and LinkedIn. We want to do mock interviews. We want to practice setting goals, not only for this program, but also for when you leave this program, a 3-month, 6-month, 1-year, 5-year, and 10-year goal. Once again, we want to lay that foundation for a healthcare career. So we take you from either a home health worker, or maybe this isn't even in your field yet, to being a nurse aide, to hopefully becoming an LPN one day or an RN. So we also want to assist you with job placement within the Blessings family to help empower you. Registry renewal. I think it's really important to always discuss registry renewal because your nurse aide can lapse. So it's really important that you work at least 1 document a day, 8 consecutive hours, every 2 years. Every 2 years. So what that means is you need to work either at a nursing home, personal care home, hospital, home health setting, or intermediate care facility at least once for 1 day every 2 years in order to keep your nurse aide on the registry active. Once again, I want to let everyone know our program has to be in person per state guidelines. So what that means is we have to do everything we can possible to really protect ourselves and each other and our patients that we will be seeing with COVID precautions. So I want you to bring a mask every day and wear it all day long. I want you to complete a COVID screener prior to you even entering the building. And if you're sick, please stay home. We will work out makeup days with you, but please, if you are sick or have a family member at home that is sick, stay home and make me aware. Also, every time you enter the building, we're going to ask you to complete an in-person COVID screening upon entering, which also includes a temperature check. Once again, we just want to keep myself, you guys, everyone that we're involved with safe. And then we're going to continue to follow all signs and maintain the highest infection control standards as instructed by me, the primary instructor. And that is all per the updated CDC guidelines. So I want to know, do you have what it takes? Please come join me here at Blessing Center for Technical Arts and Sciences. I look forward to helping you get your healthcare career started and pushing you into the nursing field. I look forward to speaking with all of you. I'll talk to you soon. Bye-bye.